Hello everyone, my name is Thierry Amédée and I'm working at the Interdisciplinary Institute for Neuroscience at Bordeaux. I'm very pleased to have the opportunity to present today the work we have been recently published in Neurobiology of Aging. The work is focused on a very important component of the most common cause of dementia across the world, the Alzheimer disease. This neurodegenerative disease is affecting more than 30 million people in the world, and in France, so far, about 900,000 cases have been diagnosed. As a matter of fact, and unfortunately, the causes of AD are almost unknown, except maybe for the genetic ones, but which represent only 5% of the cases. On contrast, what is known is the fact that Alzheimer's disease displays a strong neuroinflammatory component, which likely plays a role, a pivotal role, both in the initiation and in the progression of the disease. So for obvious reasons, human brains are not easily accessible for experimental research. But fortunately, we do have a mouse model, transgenic mice, which recapitulate some, but not all, of the symptoms of the human disease. So based on these grounds, the main aim of our study was to investigate in a mouse model of AD, the APP-PS1 mouse, if and how neuroinflammation was altering the physiological functioning of brain circuits in the hippocampus, which is one of the main brain areas which is targeted by the disease. And highly relevant to this, the hippocampus is a key structure involved in memory formation, storage, and recall. So in our study, we have recorded synaptic transmission and plasticity in a subregion of the hippocampus, where the granule cells from the dentate gyrus are synapsing on CA3 pyramidal neurons. And this DG-CA3 pathway is known to be involved in different modalities of memory processes. So first, we demonstrated that prostaglandin E2, PGE2, which is a neuroinflammatory molecule, impaired a specific form of plasticity at the synapse, the long-term potentiation. LTP is the long-term potentiation is now acknowledged to be one of the main substrates for memory processes. Strikingly, high levels of PGE2 have been detected in brains from Alzheimer patients, and in anti-inflammatory drugs such as ibuprofen, which reduce the prevalence of the disease, do block the formation of PGE2. So then after we looked to the neuroinflammatory status of the hippocampus of APP-PS1 mouse, and we detected the presence, the progressive activation of astrocytes and macroglia, but also the deposit of beta-amyloid plaques, which become prominent at 12 months of age in our mouse model. Remarkably, we also measured a progressive increase in the production of PGE2 in the hippocampus of the APP-PS1 mouse. So cellular actors that are activated glial cells and molecular actors that are PGE2 and deposit of beta-amyloid plaques were on stage. But what's about their play? Well, we looked if the synaptic plasticity was impaired in APP-PS1 mouse model, and the answer is yes. At 12 months of age, the LTP in APP-PS1 mouse was severely impaired, and most interestingly, in a way closely mimicking the impairment induced by PGE2 in control mice. So then we search if the LTP impairment in APP-PS1 was due to a building up of PGE2 during the pathology and acting on the AP3 receptors. And the answer is once again yes. And last but not least, a specific antagonist of AP3 receptors was able to fully rescue a normal LTP on this APP-PS1 mice. So to sum up our study, we have shown that PGE2, a key neuroinflammatory molecule, which is produced in the course of the disease in the APP-PS1, but also in Alzheimer patients, impairs synaptic plasticity, hippocampal synaptic plasticity at the DG-CA3 synapse. Very interestingly, this impairment was completely rescued by a specific antagonist of EP3 receptor. And I would like to finish by highlighting the fact that our study opens to the promising idea of a therapeutical targeting of EP3 receptor instead of an upstream global inhibition of the production of PGE2, which has been done so far, and which may have some deleterious effects. Thank you very much for your attention. I hope you enjoy this short presentation and that you will read our publication.